My aunt was trying to get a hold of me and let me know that he was on life support at Health Sciences. And yesterday afternoon was it. It was done.
A Winnipeg man says his uncle contracted COVID-19 and passed away in less than a week. He says it was a rapid decline and quick loss of life for a man that has been battling health issues for decades. The family's main concern is that he could have contracted COVID-19 as the result of going to a Winnipeg hospital to be treated for a cut on the bottom of his foot. Lawrence Favel, or Sonny, is the uncle of James Favel, the man who helped bring back the Bear Clan Patrol in 2014. James says his uncle had diabetes and was on dialysis for over 10 years. Lawrence, his uncle, is from Peguis First Nation and came to Winnipeg after noticing a cut on the bottom of his foot. As an elderly diabetic, it was concerning, so Lawrence chose to come to the city seeking medical treatment.
And then they did his dialysis treatment here in Winnipeg while he was here. We believe that's where he contracted COVID-19.
About 48 hours after his dialysis treatment, Lawrence was placed into the intensive care unit at the Health Sciences Centre due to complications from COVID-19. However, he did not survive it. Favel does not know for sure if his uncle caught COVID-19 from being in the hospital or somewhere else, but says it serves as a reminder for how quickly things can take a turn if you do catch the virus and why protecting our most vulnerable citizens is critical at this time.
This is craziness. It needs to be taken way more seriously.
There is a lot of nervousness and there's a lot of apprehension of people coming into the city, especially when the city first went into code red.
Assembly of Manitoba Chiefs Grand Chief Arlen Dumas has heard concerns from First Nations community members scared to enter Winnipeg hospitals during the pandemic for fear of catching COVID-19. Dumas acknowledges the concern is real. However, he is applauding the teams responsible for transporting residents from reserves to hospital and the hospital staff for being as safe as they can be during this difficult time.
And unfortunately, COVID is among us. COVID is everywhere, and there is always a risk. But I have confidence in the system.
That said, people are going into hospitals without COVID in Canada and coming home with the virus, according to Health Canada.
The most recent data is that there have been about 262 outbreaks within a healthcare setting across Canada, and with that, about an 8% mortality rate.
Epidemiologist Cynthia Carr doesn't want people to be scared to go to the hospital for any treatment, but she does want people to understand safe practices like mask wearing, hand washing, and social distancing are even more important to follow in a healthcare setting. As we've seen in Nunavut, all it takes is one case of COVID-19 to enter a region, and case numbers there can spike.
Nunavut has gone from no cases to 70 cases in the span of less than 2 weeks.
As for Favel, he wants those who don't believe in the virus or who are purposefully disobeying public health orders to understand the deadly cost of catching COVID-19 for anyone, especially those with underlying health conditions.
This didn't need to happen. My uncle doesn't need to be gone today. And that's what's really painful for me.
In Winnipeg, Mark Neufeld, City News.